All right, first step is we're going to clean your face. It's really important that you come to the office with a clean face, no makeup, moisturizer, nothing. If you could just use a gentle cleanser and wash your skin in the morning like you normally would. The IPL can actually pick up any pigment in your makeup, so that's why it's really important not to wear any. Perfect. Next step, we're going to protect those eyes using some sticker shields. These will place over your eyelids. Just keep your eyes closed. These sticker shields help with any of scattered light from the IPL. Even though I'm targeting a certain area, the light does scatter, so this is going to really make sure we're protecting those eyes from the light. Perfect. Next step, we're going to put some ultrasound gel on your face. It's going to be a little chilly. This ultrasound gel will help with our procedure as the machine glides through, making it nice and smooth on your skin as I deliver the heat and energy. So today we're going to target some brown spots on our patient and redness to the cheeks. One nice thing about the IPL is, yes, it does have specific settings for the redness or brown spots depending on what you want to target, but ultimately we can't just choose one or the other, so you're kind of getting the benefit of both brown and red pigment. With our patient today, we're going to focus on her brown spots or age spots that we want to soften and lighten for overall even skin tone. So we'll do a test spot today since we're bumping that energy level up to deliver the most efficacious treatment for the patient. All right, this is the IPL handpiece. This mechanism right here is a cooling mechanism, so as it's delivering light and energy, this will also cool down the skin, which is really comforting for the patient. I'm going to always do a test spot, usually right above the ear, so we'll start with that. I'm going to have the patient turn their head a little bit. And I'm going to deliver in 3, 2, 1. So when I do a test spot, I am looking just to make sure that there's some type of reaction. We do want like a pinkish look to the skin after I deliver the light and the heat. Usually patients report the sensation feeling like a rubber band snapping or like a prickling sensation. This is completely normal. This is what we want for the most benefit out of the treatment. But of course, our number one is patient safety and it's not causing a burn. So I'm just going to give that a few minutes to see how the patient reacts. Her skin. So far, no adverse effects. The most beneficial thing for me as a provider here when I'm delivering this service is honestly your feedback. So if you go home and tell me the next day, you know, what we should eventually see is some peppering to these brown spots. It'll kind of look like a salt pepper and it should flake off. That is the goal of the IPL, to basically even out and get rid of those brown spots or calm down that redness. It's really beneficial. The patient kind of keeps track for me because then we can, it's really in tune to you and about your face and making a care plan for your face and how you react. All right, so looks like we are ready to proceed. We will continue. If you need a break at any point, just let me know. And we'll just stamp across the patient's face. You want to make contact to the skin, but I'm not pressing down the skin, especially for rosacea patients. By pressing down too hard, you're blanching the skin and it's not going to be able to target that redness. In women, we really make sure to stay away of any pigmented areas like microblading to the eyebrows, or in men, the bearded area. We want to avoid, because this machine can actually do some laser hair removal as well. But the goal of obviously the photofacial is to not take those hair follicles with us. Her skin should be little pink, red. That is what I'm looking for, the reaction. The brown spots, I'm hoping already to see some peppering. Again, with this treatment, it's very easy and efficient because, again, minimal downtime. You're going home the same day. I do tell people avoid wearing makeup the day of the procedure just to give your skin a little break. It's going to feel like a mild sunburn at the end of it. So I just tell people to wash their face with cool water and use their gentle cleanser. But by the next day, exercise, makeup, everything that you would do in your normal routine is completely okay. So after doing 2 passes, we're gonna remove the gel completely. And I'm gonna grab some cool compresses to put on the patient's face. We'll give that skin a minute to calm down from the light and the heat. It'll feel nice and cooling. And then we'll remove the sticker shields and putting a sunscreen on before the patient leaves the office, at least SPF 30. And that's it. That's the procedure of IPL. Again, we're looking for overall skin color correction and evening that skin tone and skin tightening. All right, we're gonna remove those sticker shields. Sorry. There we go. Beautiful. Just get the gel removed for you. Okay, go ahead and open your eyes. It's gonna be a little bright. How are you feeling? Good. Yes, nice and bright. Let me just this gel off for you. Good. All right, I'm gonna tilt you up. This back. All right, give you a minute. So again, at this point, the skin should be a little pink red. This is exactly what I expect to see. It should look like a mild sunburn. You'll go home, wash your face like normal, just a gentle cleanser and a light moisturizer. Stay away from any anti-aging or any of your lotions, potions with acid in it or tretinoin and retinols. You'll want to hold that for 48 hours. After that, these IPL treatments are most beneficial in terms of sessions. So to truly target everything, we need at least 3 to 4 sessions, usually is what I expect for most people. But there should be no pain and just care for it like a mild sunburn, basically. And tomorrow, back to your normal routine.
Perfect.